Okay, so what we are going to do today is, because there are uh, several aphorisms, nearly 20 aphorisms that pertain to case taking. Uh, it- Doing each aphorism individually would get boring. You will feel bored after a while because that is what people say about organ, it's boring. But if you actually start seeing it in practice, then it becomes really very interesting. So this is what we are going to do today. I'm going to show you a case, uh, and at each step I'll pause the video, and then I'll discuss the relevant aphorism that has come into play in that particular scene. Okay, so you will be actually able to see it all alive. This is written and this is how it is practiced. So this is a case of sarcoidosis. The first consultation date was 5th May 2015. He's a male patient, 39 years old, and by profession he is a software engineer. What the patient gives, a basic information that the patient is given is that he has sarcoidosis. He has pain in the right parietal temporal region and the right eye, which is worse when he has acidity and flatulence, worse when he is hungry. There's burning in stomach, sour eructations, pain abdomen, which is worse by pineapple and pan, history of recurring diarrhea and vomiting, which is induced by muskmelons. And he has another complaint, that is teeth break off easily, has dental bridges. He is irritable, dreams of falling from high building, being hit by a bull, of being killed, of being murdered, wakes just before the dream happens, ends. He is a friendly person, he is helpful, he has a high libido, he is high responsibility, was under stress for 6 to 8 months before sarcoidosis was diagnosed, and sleep wakes in every 2 hours. He has perspiration profuse, no, earlier it used to be scanty, and has low thirst. So this is the gist of the case that the patient gave us during the process of consultation. But the patient never gives information like this, does he? No. The patient never gives information like this. It's not structured like this. A lot of times you have to actually be creative in posing questions, in asking the relevant questions at the right time, in understanding the importance of a specific symptom at a given time. So what we are going to do is, instead of moving further ahead, we'll start the video case and then see how it. What is this? Level 1, the name of the disease. Majority of time the patient comes with this. This is the only thing that the patient comes with, and this is the only thing that the patient is bothered with. He doesn't know anything else. He doesn't want help with anything else. Majority of time the patient wants to stay at level 1 or 2. Name या fact की level पे ही रहना चाहता है. He wants to stay at the level of either name or fact. Why? Because he doesn't understand homeopathy. He doesn't know what we need for a homeopathic case taking. He comes with an allopathic mindset, because that is what allopathic doctors do. Okay, you have this disease, you give the basic facts about the disease, you get the test done, and here is your prescription. Cut, 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 cut. The patients are conditioned to that. The patients do not even know that a doctor needs to listen to them beyond the name and fact level. For them, this is the beginning and the end of the disease. They don't understand the role of etiology, the causation, the emotional aspects of the disease, the past medical history, the family medical history, the sleep, the desires, the aversions, the dreams, the delusions. It's for us crazy homeopaths that we need all this information to actually treat the patient. But the patient doesn't know that. So, from this level, how do we move forward? When you will see that this patient is going to get stuck at level 2, he doesn't want to move forward. He doesn't want to. I speak of level 1 and 2 because you people are learning that method. I personally don't follow that approach. It's just, but it's the method of case taking is same. That is what I'm saying. Even if I'm not following that method, the method of case taking is more or less same. There could be slightly different focus on certain areas of case taking or slightly different approach. But when you grow at a certain level in your clinical practice, you become artistic and you start using a lot of different techniques based upon the case, not based on your prejudice. Not based on your prejudice. Never say that you are a sensation method practitioner. Never ever say that. Because that would be a prejudice. That means you will solve every case with sensation method. Who are you to decide that? If the patient doesn't go to that level, how you will treat it? Even Dr. Sankran is not so hardliner. He says use any method that the patient gets better with, that the patient is at the level, treat him at the level at which he is. Not every patient is going to give you dreams and delusions and sensations or the energy. Then, so every symptom is important, every state is important. I hope you have seen that this was a proper textbook case, and with a proper follow-up, everything that we have done is according to organon, right from the moment the patient enters, and with every step where the patient goes, choosing the remedy, choosing the rubrics, giving importance to what rubric we have to give importance and which rubric we have not to give importance, how to prod the patient, how to ask the questions, what to ask, what not to ask, when to stay silent, when to speak, how to choose a potency. I'll discuss that in the next session. How to repeat, how to do a follow-up. Everything has been just as mentioned in the organon. And you would see that it's nearly exactly the same way like you see cases here. There shouldn't be too much of a difference. Not too much of a difference. Slightly, probably the focus areas change because of the training that you get. I'm not trained, so probably the focus area is not there. But at the end of the day, what matters is the patient's well-being. Patient gets cured, that is more important than what school of thought I'm following. Patient is least bothered with that. Patient has come to you for relief of his complaint. If you are able to deliver that, then as good. Any school is as of thought is as good as it gets. So follow any school of thought, but follow the basic principles. If you don't master the basics, then you will fail in whatever approach you follow. But if you follow the basics, you will ultimately go to the same remedy, even different approaches, because if there is a similimum, there cannot be different similimums based on different approaches. Can there be? Can there be? A similimum is a similimum. A similimum is a similimum. It cannot vary according to the school of thought that you follow. So whether you are following Vijayakar or Vithulkas or Sankran or Lippi or Sholton or Scher or Hahnemann or Dr. Bhatia or yourself, the remedy should be same. Remedy should be same. The curative remedy should be same. So don't bother about the approach per se as long as you are able to reach the destination. These are all slightly different paths. These are all slightly different paths which actually reach the same goal. But remember, there is a highway that Hahnemann built. There is a highway that Hahnemann built. These are just different lanes on that highway. But you have to follow the path that Hahnemann actually built. These are certain, like, You know, on highways there are bridges and elevated roads on sections. So probably these are that to lead you to the simillimum in a different way, in a quicker way, sometimes in a shorter way, or slightly a slight different detour. But the highway was built by Hahnemann. If you don't follow the highway, you're going to end up in kachra. First master it. Anything. There is no doctor, no teacher who will say that he doesn't follow organ. You have seen that what I'm done is nearly what you have been taught or what you are being taught. We are following different approaches, but the focus of the case doesn't change. The focus of the case doesn't change for me or for you or for any other practitioner. The method of probing might change a little bit, but the remedy should not change because the curative remedy is always the same. So this is case taking for you according to Hahnemann.